Welcome to The Explainer. So today we're diving into something that is incredibly frustrating, and that is back pain that just stays in your back. No shooting pain down the legs, just a constant localized ache. Medically, we call this axial low back pain, and it is honestly one of the most commonly dismissed types of pain out there. You know the story. You get an MRI, the report comes back reading normal, or maybe just a little vague, and you are left sitting there feeling like the medical system literally just doesn't believe you. Well, today, we are tackling that heavy emotional burden head-on, along with the very real fear that comes with the thought of treating it.
There's a feeling that perfectly captures the situation, being absolutely miserable from the pain, but at the exact same time deeply afraid of spine surgery. If you've been bouncing around seeing multiple doctors, repeatedly hearing, hey, nothing is wrong, but you inherently know in your gut that something is definitely not right, well, this probably sounds incredibly familiar. Let me just say right now, you are not alone. And more importantly, you are not wrong to feel this way. This fear, it lives in that brutal gap between two really hard choices, right? On one hand, you have pain that has literally hijacked your daily life. On the other, surgery feels like this terrifying leap into the total unknown. We see so many patients delay their procedures until they basically can't even walk anymore. But that fear, it's a completely normal, entirely appropriate response. All it really means is that you're taking a major medical decision seriously.
I want you to pause for just a second and ask yourself, what exactly are you picturing when you think of spine surgery? Seriously, think about it. Most of us walk into a consultation room with a very specific, usually very vivid picture playing in our heads like a movie. And let's be real, that picture is usually terrifying, which is even worse when your pain hasn't even been properly validated by past doctors or by those normal MRIs. Maybe you're picturing a relative who had surgery decades ago and, just never quite got their life back. You're picturing this incredibly difficult, painful ordeal. But here's the thing, that picture in your head, it is likely based on an era of medicine that is largely in the rearview mirror for a lot of common procedures.
For so many people, the nightmare scenario looks a lot like this outdated picture. We're talking long incisions right down the middle of the back, hospital stays that you measure in days, not hours, weeks just completely stuck in bed, unable to do much of anything, and a really heavy reliance on strong, extended-use painkillers. Now, this was the reality of spine surgery maybe 10 or 20 years ago. And, to be perfectly honest here, for some complex cases, like multi-level fusions or severe spinal deformities, open procedures and longer hospital stays are still required. But for a huge number of common spine issues, this terrifying picture is exactly what keeps patients suffering in silence instead of just getting a consultation.
The good news is that medical science hasn't just been standing still. We have largely moved away from those massive incisions and weeks spent recovering in bed. We've stepped into a modern, minimally invasive reality. Think about it. Today, we are often talking about cuts that are roughly 1 inch long. We're talking about getting up and walking the exact same day. And for many appropriately selected patients at outpatient centers, we're talking about going home that very same day. It's a total game changer. It is a complete paradigm shift in how we approach the spine and how we manage the recovery process.
So let's define what we actually mean by minimally invasive spine surgery. The absolutely crucial point to understand here is that minimally invasive does not mean minor. It is still a real surgery. It still requires anesthesia, careful medical planning, and of course, real recovery time. But the magic really lies in the path the surgeon takes. The end goal is exactly the same, fixing the underlying spine problem, but it's achieved with way less disruption to the healthy tissue around your spine. Surgeons are now using smaller cuts and special muscle-sparing tools that gently push tissue aside rather than just cutting right through it.
Okay, so how does this actually play out on the big day? For many common minimally invasive cases at outpatient surgery centers, the rhythm of the day is incredibly structured. Step 1 is arrival and intake, and honestly, this is usually way faster than you'd think because your team already has your entire plan dialed in. Step 2 is the pre-op conversation. Your team is probably going to ask something like, what do you want to be able to do again? They want to know your specific goals, whether that's walking the dog or just getting back into the garden. Step 3 is the surgery itself, which is often measured in just hours. Step 4 brings us to the recovery room, where they start a layered approach to pain control. Step 5 is a big one, your first walk. Yes, often that exact same afternoon, safely supervised by the care team. And finally, Step 6 is same-day discharge. For these outpatient procedures, you literally go home the same day, no overnight hospital stays. You get to recover right in your own familiar environment.
8 hours. That specific window of time represents one of the most massive shifts in modern surgical recovery. To put this into perspective, there was a massive 2022 study published in the journal Neurosurgery that looked at more than 25,000 elective spine surgeries. That's a huge data set. And what did they find?
They discovered that patients who walked within just 8 hours of their surgery had significantly better outcomes across basically every single measure. We're talking fewer complications, shorter hospital stays, lower readmission rates, and way higher patient satisfaction overall.
Clinical teams will tell you this all the time. Walking soon after surgery is one of the absolute clear signs that recovery has officially begun. This whole concept is part of a modern protocol we call enhanced recovery after surgery. The old school way was just to stay in bed and take heavy opioids, but the modern way? It's all about early ambulation paired with multimodal pain control. Now, what that actually means is managing your pain through several different layered methods, rather than just relying on strong opioids to do all the heavy lifting. The primary goal is just to keep you comfortable enough so that you can move, you can eat, and you can sleep. Because at the end of the day, the patient who moves is the patient who recovers faster.
Now, before we get into specific timelines, there is a crucial medical caveat you have to remember. Recovery timelines are a compass, not a contract. Your specific recovery depends heavily on a bunch of different factors. Was your surgery an open procedure or minimally invasive? Was it a simple single-level fix or a more complex multi-level one? Was it in the lumbar region, your lower back, or up in the cervical region, your neck? On top of all that, you have to factor in your overall baseline health before the surgery and the kind of support system you have waiting for you at home. Every single patient's body is going to heal on its own unique schedule. That being said, we do have some fantastic data to give you a really realistic compass based on published research from the journal Spine looking at minimally invasive recovery timelines. Let's break down the main takeaways here. For lumbar or lower back procedures, patients are generally getting back to driving in under 3 weeks. Returning to desk work takes about 2 to 4 weeks, totally depending on if you had a laminectomy or a fusion. Moving up to the neck, whether you're looking at a cervical fusion or a disc replacement, driving and getting back to that desk job generally hovers right around that 2-week mark. And notice this key detail. Across the board for all of these procedures, the median time patients took to actually stop taking opioids was just roughly 1 to 2 weeks.
Now, I really cannot emphasize this next point enough. These numbers are study medians. They are absolutely not promises. Some patients are going to bounce back much faster, others are going to take a bit longer. And you know what? Both of those scenarios can be completely 100% normal. These numbers are really just here to help you ask your surgeon better, more informed questions. They are not a green light for you to just jump in the car or head back to the office on your own. Your surgeon's specific medical restrictions always come first.
Let's shift gears for just a minute, because anyone dealing with this knows that spine pain doesn't just happen to the patient, it happens to the entire family. People ask us all the time, can my family come to the consultation? And the answer is a resounding absolute yes. If you are watching this right now and you happen to be the spouse, the adult child, or the best friend of someone living in chronic pain, we know that you are completely exhausted too. You have literally watched their world shrink right before your eyes. You want to help, but you're just totally out of ideas. Let me assure you, you are a crucial, indispensable part of the care ecosystem.
Caregivers absolutely belong in that room because you bring vital observations that the patient themselves might not even realize are happening. A really good consultation? It's a 3-person conversation. The surgeon needs to hear about those subtle little changes. They need to hear about the change in posture at the kitchen table, the fact that your loved one quietly stopped going up the stairs a month ago, the skipped baseball games for the grandkids, the changes in their mood, their sleep patterns, or their general confidence. Bringing the people who love you into that consultation just makes the entire medical picture so much more accurate.
And here is the incredible emotional payoff of a successful recovery plan. Many patients describe not even realizing how much pain they were truly in until it finally went away. You see, when you live with chronic pain for months or even years, it stops feeling like a specific event and it just starts feeling like the weather. Your brain just adapts to it. Your horizon slowly shrinks. You quietly stop doing the things that bring you joy. And then, when that pain finally lifts after a successful procedure, patients are often briefly disoriented. They suddenly discover just how much their entire life had narrowed around simply managing that pain.
So I want to leave you with this final provocative thought. Is fear the only thing keeping you from taking that next step? Remember, booking a consultation is really just a conversation to get an honest, clear picture of your specific situation. It is not some binding commitment to getting surgery. And please hear this, seeking a second opinion is not a criticism of your previous doctors. It is simply a reasonable, responsible next step when your pain has lasted longer than anyone expected and the story of your MRI still just doesn't make sense. Get the facts about what modern recovery actually looks like. So whatever you decide to do, it's based on reality, not on fear. Thank you so much for joining me on this explainer. Stay curious and stay informed.